Yeah, so hello everyone, and welcome to yet another session of Life of a Resident. And we are getting many of the comments on this that you people are liking it. So, on persistent request, today we have brought a residency, a person who has done residency in the pediatrics. I think this is one of the feared branches because pediatric residency requires a lot of patience. So let's try to learn from Meenakshi that what are the typical things that a pediatric resident should be experiencing. So first of all, welcome Dr. Meenakshi.
Hello.
Yeah, hi. So I think people will be very happy to listen from you, the life of a resident of a pediatric person. First of all, can you introduce yourself? Because I think you are old association, and you people will be glad to know that she was our foundation student also at DBMCI Mumbai Center. So, Meenakshi, tell us something of your journey from that day then till now.
Hi guys, I'm Dr. Meenakshi Day. So I have passed my pediatrics just this year. Last month the results came. So freshly passed out. So I had joined DBMC in my second year. So everyone said it's too premature to join DBMCI. You should join in your third year. Then you'll have more time to read. And of course, everyone knows you guys have already gone through it. The entire weekly goes to college all weekends. Steps clear before joining residency. Like pediatrics is not a very common branch. During our UG, we don't really read too much of pediatrics. It's like an ignored subject. We don't really indulge with the kids. We really don't understand what the branch is about. But then Pankaj sir used to take our classes for pediatrics, and so having the developmental milestones, how important they are in pediatrics. Like in pediatrics, growth and development is like your bread and butter. So it's very, it's nice to have some concepts of pediatrics before going into the field. At least, in the first 6 months when you don't have time to read at all. But of course, you're expected to know basics. So only those what you have learned in your DBMCI classes beforehand, only that particular thing helps. Because of course, in our MBBS, while studying for it, we don't really study pediatrics. So
Yes. So I'm just telling the people that they can ask your questions here. So I think you have told a very important thing that yes, milestones are an important thing, and really we have all fear from the children, and that was there in me too. And whenever I used to visit the pediatrics ward, I decided one thing that I'll not go with the pediatrics, come what may, because as soon as you start examining them, they will cry, and then you do not know what has happened. You start checking your face that are we so horror that the children are crying at your face. So yes, so you require a lot of tactics and skills, warmth, patience to be a pediatric resident, right? So we know that your journey was there, and you performed well, you joined. Tell us something about where did you did your PG residency, and now currently where you are working as a senior resident.
so I did my PG residency in Kashibai Navli Medical College, Pune. And right now I'm working as an SR at by Jerbai Wadia Hospital for Children in Parel, Mumbai.
All right. So first of all, the most important question, Meenakshi, that why did you join pediatrics?
I really like kids. Means, at home also I have a good rapport with kids. And second of all,
Okay.
I wanted to join a medical field. So medicine or pediatrics was my choice. But then
Mhm.
when I find the final time I had to put my choices. So I was just thinking, do I really want to do alcoholic liver disease? Do I really want to catheterize old people? No. So and I knew, while doing anything for children, you don't feel bad, you don't feel that yuck thing. Children are so innocent. You just tend to do not regret doing anything for them. So that's why.
All right. I think that's a sweet answer, as sweet as you are. So pediatrics is certainly suiting to you well, I must say. So now, Meenakshi, when you have joined the pediatrics, what do you think that how much different it is from your, thinking? You thought something about pediatrics and you joined. Now you know the real versus reality. How much different it is when we start thinking about pediatrics and then we start doing the residency in pediatrics.
Pediatrics actually, I think it's a very unexplored branch during MBBS. So we really
Mhm.
don't think about it. So for
Mhm.
us, pediatrics is a very limited branch. But when you really enter into pediatrics, like you realize you're neonate also. You don't just have pediatrics, and neonate is a very big section in
Yes.
general pediatrics. So like even if you like nowadays they offer many fellowship in neonatology, but even if you don't do this fellowships, you have sufficient knowledge of neonate because there's a compulsory every year 3 months NICU rotation, which has to be done in the 3 years of residency and PNC
Mhm.
rotations. So it's a very unexplored field. People think there's no super specialization in pediatrics, but no, that's not the case. There is. And then people think you can do adult endo and adult things and treat pediatric patients as well. So it's very
Yes.
different. So, once you really, if you have really interest in pediatrics, then once you join, you'll find it's a very nice and interesting branch. It's not as boring or as tiresome it's considered as.
All right. So, what do you think are the main pros and cons of this branch?
So the pros are, as I said, children are very innocent. You don't feel like regretting doing anything for them. You know, those night shifts and all. You just feel at the end when the child goes happily home, the parents are happy. Like a child plays a very important role. So
Mhm.
like adults is rather like बच्चा जब घर में बीमार होता है तो we say that the entire family is sick, not only the
Yes.
child, because they have so much affection. They're so innocent. Like you do not
Mhm.
feel like you should lose a child.
Mhm.
So when the child goes happily home from your PICU or from your NICU, when a parent says they have been trying to have a baby for the last 10 years, this is the only child they have, and then they go home happily. When they come for the visit, subsequent growth, immunization, it's so good to see them so happy. It's just worth it, I feel. Everything, all the pain for it. And cons that people say that it's a less earning branch. So right now, I don't think in your career you should think about earning. So, but still, many people are very like oriented कि नहीं medicine में बहुत पैसा है, pediatric में पैसा नहीं है. So yeah, it's a less earning branch I think compared to medicine.
Acha, so you agree
Uh,
with this? You agree with this? Ki pediatrics is a less earning branch.
yeah, definitely.
Definitely.
Like
But I
mine
think
too.
Meenakshi, any branch can earn. Like you should know, you person earns, not not the branch. So if you want to
Okay,
earn,
what
you can
they
earn in
say
any branch.
medicine my co-medicine people like my friends and all this so हम लोग रास्ते पे भी एक open clinic करते clinic तो भी there's a line of people. So
Okay.
and it's not the same for pediatrics. So like pediatrics is the, like people are very reserved also. They really trust the long time pediatricians whom they have been
Mhm.
showing for years and years. Like my father still touches my pediatrician, so it's like a very trustworthy. They're
Mhm.
very scared to show the children to new pediatrician. So for a new budding pediatrician, it's
Uh,
difficult to
so,
establish.
matlab pediatrician should have a gray hair, otherwise he is
Yeah,
too
yeah,
immature. Yeah.
that's one.
So, there's one question that do you ever have a regret taking pediatrics,
No,
Meenakshi?
never, never.
Then, is your residency too hectic? Means, what about personal life, mental health, something like this?
See, residencies always each field it's very hectic. So
Yeah.
yeah, you always get to time. You always get have to make some time for yourself. And especially since COVID has come in, the number of patients I think in all the branches have decreased. And COVID postings have been more indulging. So of course, if your hospital has COVID postings, then you'll be busy. But otherwise, yeah, COVID has given a little kind of an off from the main clinical branch what everyone is pursuing. But then you need to balance it. You get very little time for your personal life, but then eventually once you get used to it, at the end it's worth it.
All right. So, can you define a typical day? What was there in PG residency, like typical OT day or the OPD day? What kind of hectic work, or what days were your cooler days? What kind of life you were having that time? As a first year, as a second year also, and then as a third year also.
So actually, we used to have six places to work in. So one used to be the PICU, pediatric ICU. One used to be the neonatal NICU. One used to be the PNC, the normal neonate ward. And then
Mhm.
we had three wards, three units. Most hospitals have three units in pediatric, as compared to medicine. Medicine usually has 6 units. Surgery has 6 units, but pediatric has 3 units.
Mhm.
So we used to be six people in one batch.
Mhm.
So two people used to be in the same. Basically, each ward only one resident each year ka. And one in PIC, one in NIC, one in PMC. So we used to have calls twice a week. Calls are emergency days. That's when you're 24 hours of working. So, example, I'm Monday call and I'm in the ward. So I'm supposed to first see the OPD in the morning, then all the patients who are admitted from the OPD. And in medicine, what happens? Patient comes, sister puts the intracat, you just put the orders and everything is done. No, it's not the same in pediatrics. So because you have to put the intracat, because most of the times sisters won't put at most places.
They are not
You have
able
to
to,
put
and they are
there.
reluctant
Yeah.
also.
Yeah, so and parents also reluctant कि डॉक्टर ही लगा
Doctor
एक से
लगा.
ज्यादा prick हो जाए sister से, so they'll start fighting only there. So
Mm-hmm.
you have to put the intracat. So all the patients, you have to put the intracat, you have to do the collection, you have to fill the forms also, you have to write the history also. And so history is not like okay complaints लिख लिए examination कर लिया. No, growth development, again development milestones. 5 year old child also जब पैदा हुआ था neck holding कब शुरू किया, roll
हाँ, ये
over कब
सारा
शुरू
आई
किया.
थिंक रिमाइंड कराना एंड रिकॉल
Yeah.
कराना इज अ वेरी वेरी
Yes,
टायरसम
and
जॉब.
for every child related अगर irritated, is it related आप तभी का क्यों पूछ रहे हैं.
हाँ.
But pediatrics में growth development milestones, everything is very important. The professor is going to ask you about the milestone. Is the child sure? When does the child start this? And the only one question you don't take it now, definitely professor will ask it. I don't know how they get that sense that you haven't taken
Yeah,
that patient.
that is why they are professors, na Meenakshi.
Yeah. So
So
it's really
yeah,
heavy. So
this
every day
happens
patient.
always. The thing which you have not asked for very carefully also, then the professor will ask in front of you, and then they will answer also. Otherwise, they will not answer you
Yeah,
these things.
exactly. I don't. They have a very good sense. The only patient you'll think अरे यार एक ही patient छोड़ा था इसका ही पूछा उसका नहीं पूछा इतना detail लिया था तो.
Yes.
So that is there. So every patient the detail history has to be taken, and then after for the OPD closes. So of course
Hmm.
casualty calls रहते थे. We used to have section and labor calls, and then वो cannot
Hmm.
be forgot. So एक जगह पे casualty call आ रहा है, एक जगह पे section labor call आ रहा है. Then कहीं पे when there's LSCS, when there's high risk delivery, so you have to go for there that also. And then after
Hmm.
9 p.m., like after round informing and everything is done, so PIC people used to leave their shift. So we didn't have fellows in our hospital. So everything
Hmm.
used to be on residents. So that's a good point. There are a lot of hands-on you get when you have no fellows in your hospital. So whatever you have taken. So then after 9 p.m., after the round informing is done, then we have to see PICU also and the casualty ward से कोई patient को fever आया है, because in pediatric even fever they get very apprehensive. In adults में क्या बोले यार fever है 3 दिन में चला जाएगा,
Hmm.
but having a 6 month old and having a 1 or 2 का fever, that makes them very apprehensive.
Hmm.
So you have to go and see. Then excessive crying, it's going to spoil your night. So you don't want a pediatric resident. 3 a.m. को उठ के आगे parents is crying excessively. Many times you'll find it
Yeah.
irritating also, but for them it's very concerning that 2 months old is crying, crying, crying. It must be just a colic or just an normal nature. The child wants to be rocked, cuddled, and all. But then these all kind of patients definitely come, and of course, other serious emergencies also come. But
Hmm.
these are those which you will find irritating. And initially you'll find it, अरे कितना क्या इतना बुखार कभी आया नहीं क्या आपको जिंदगी में, बच्चे को बुखार आ रहा है तो इतना क्या apprehensive हो रहे हो. But they are very concerned about the child.
Yeah, especially the first parents are very very
Yeah,
mature. The second time pe to they will get to know all these things, but
yeah.
first parents are like this. Yeah.
Less than 1 year baby having 1 or 2 child, 1 or 3 fever.
So
Like,
there is a question ki how do you deal with these apprehensive parents at the middle of the night? when they are coming
So
to you? How do you
you
deal with them?
need to be very patient. You need to be very calm. You can't be shouting at them. You can't be saying आपको समझ में नहीं आता. So my was patient. रात में 12 के बाद casualty आया. I used to admit. इतना भी I knew ना कि इससे URT है. अरे नहीं नहीं आप admit ही हो जाओ because you know they'll come after 1 hour. You send them home. You counsel them
They'll
everything.
come.
Be calm, but you come back after. Or they come in the morning in the OPD and tell the professor that हम तो रात को आए थे. रात को हमें भेज दिया वापस.
Hmm.
So my rule was I used to admit them only. At least I know the patient will be in the ward in some corner. At least then the patient will be better. He'll sleep for the night and then I'll discharge in the morning. But still, they'll also feel better.
Yes.
They'll let me also sleep for some time. That's what.
Yeah, good one. Okay. Acha, one more question. Can a pediatrician can also do a DM in adult specialization?
So I don't. You cannot do a DM adult specialization. Yeah, but you have some idea of the like. So basically, this DM neonatology. So of course that can be done in adult. And then there are very few seats of DM endocrinology. Only 2 seats, I think. So ऐसा नहीं है कि pediatric करके adult भी देख सकते. There's pediatric now. In the entrance is now very focused. So initially it used to be for everything, but now it's very focused. So you cannot see, but people.
Um,
You have
One a very interesting question. If you could go back in time and take another branch, then which one you will go for? Was
Hmm.
there any other choice also, Meenakshi, with you?
Yeah. Yeah, so I was getting this GMC Nagpur for OBGYN and BGMC for surgery at that time also. But I was very sure I don't want any of it. And after attending pediatric and seeing how the OBGY calls go, I would never take the OBGY again. At least never the OBGY. Anything else but never OBGY.
Okay. Acha, one more thing. What is the view on MS ophthalmology versus MD pediatrics? यार कुछ भी I think correlation नहीं है in MD pediatrics and MS
Exactly.
ophthalmology except for I am ophthalmologist as my husband is pediatrician सिर्फ इतना ही
Oh.
correlation है क्योंकि one is a medical branch and another is a surgical
Yeah.
branch, so you have to look at your passion. What is your passion? You want to go for the medicine or you want to go for the surgery? Like I was always towards the surgical branch that I want to go, and she was having love for medicine and then too for children. So I think Anu, it you have
Yeah.
to pick your see your pick. How much different it is like MD pediatrics and DNB, Binakshi?
So basically, I think it's about your institute. First of
Mm.
all, for that ophthalmology and pediatrics, never take a branch you're not interested in. Just never take it because people think it's good or people think it's bad. Always take your interested branch because you'll regret taking a branch you don't like later on. You have to
Yes.
have your dedication towards your branch. Otherwise, you will feel it's a burden, not a plus point. So that's what. And MD and DNB. So see, for any subject, MD and DNB are different concepts only. Of course, it's an NB degree, and on paper it's equivalent. Okay, and while I think it's taking SR shifts and all, I don't think it matters also for DNB. But yeah, the institute matters. I have known some institute, some corporate institute where people don't get hands-on. So there are fellows for each. When you go in PIC, there are fellow. When you go in NIC, there is a fellow. So for an umbilical line, also they'll call the fellow. At my institute, MD, there are other DNB institute also like Cooper Hospital, Mumbai, RGMC Kolhapur, where there are no fellows, nothing. Everything is on you. So you get superb hands-on. So the hands-on should be good in pediatrics. You should be confident while putting intracats. And in corporate, I have heard that वो intracat लगाने से but they are like नहीं. See, they are paying so much. It's clear when you pay so much, you'll expect a senior person to do it. So the hands-on should be good. And then their academics should be good. There should be good cases. There should be good rounds. There should be case presentations and all. In DNB corporate hospitals, many that doesn't happen. So it depends on your institute. Many in MD deemed colleges also it may not happen. So it's not MD versus DNB. It's just institutes which you need to focus on. Once you're talented, you have done it DNB or DNB also doesn't matter. Your talent, your knowledge matters. Eventually, people will recognize it. That's it.
Okay. Again, a very interesting question. How many times you were scolded in front of the patients?
How many times? Can't keep a track of it.
आई थिंक जिसने पूछा है बहुत ही इंटरेस्टिंग क्वेश्चन पूछा है. पीजी मीन्स you will be scolded in front of the patient. I think it does not depend upon the branch, and patients are also like they are doing like this and they are smiling because they know that you have tortured them and they are happy that now
Yeah.
now you are being tortured. तो वो होता है. उसके बाद they are asking any biggest mistake that you committed during your PG life? Like
Biggest
obviously
mistake.
PG life may we are committing mistakes, so anything.
It's a learning phase. You feel
Yeah.
bad if you miss something. I just feel really bad, अगर मैंने कोई finding miss कर दी, and then the professor or my senior has to come, and especially अगर उस diagnosis से related, I feel very bad कि अरे यार, how can I miss? So, but then you learn from it. I was just telling my juniors today only where I'm working right now. एक foreign body suspected था. They are not sure. So I auscultated and all. I like, no, this is like a foreign body. Get a CT done urgently, get a bronchoscopy done urgently. In my first year, I had missed a foreign body. I couldn't really appreciate. They had a clear history of foreign body, but I thought that any patient stable lag raha hai. So I missed it. And my seniors could recognize, of course. So the patient got stabilized. But I felt really bad that why didn't I really put my attention on the company? Why was it told by the others? So of course you learn from it and those experiences live with you for lifelong. So there are no mistakes, but yeah, they're learning experiences.
Okay. So then they are asking you that why did you choose pediatrics instead of general medicine?
I said children are very innocent. I don't feel doing bad for doing anything for them. Adults, I feel most of the times it's very harsh to say, but alcoholic liver disease, hypertension, diabetes, no, not paying attention to their health and then coming again and again, I get very irritated. Like my father also, he's a diabetic, and if he eats sugars and then his sugar get rises, I get very angry at him. That why did you eat when you know you're a diabetic? But children, you don't get to be angry. They're so innocent. ठीक है खा लिया, ठीक है कर लिया.
Yes. All right. Right. So what is your topic of thesis, Meenakshi? What was your topic?
Yeah, so it was study of CPAP and respiratory distress in newborn in NIC of a tertiary care hospital.
Okay.
Yeah.
So, do you think that the thesis topic really makes a difference towards your liking, what kind of fellowships you are going to do, or some super specialization, or your area of interest towards it? Does it really matters?
So you choose a thesis topic when no, you choose a thesis when you're very amateur in your first year of residency. You have hardly been into it for 2 months. How will you even recognize? At that point, you don't even know what are the subspecialties.
Yes.
So it's like given to you. It's not by taken by
Yeah,
you.
choose तो किया
Yeah.
ही नहीं जाता. It's given.
Yeah,
Yes.
so they'll tell you, no, you get topics, and then when you take 100 topics, they'll still select the topic of their choice only. Okay, even if
Yes.
you don't like it or something. So it's given to very immature and it's very irritating to do thesis.
Okay. All right. Do you think that female pediatricians are better than male pediatricians?
No, I again think it depends on your knowledge, your compassion. Like people think female pediatrician look very senior, very serious and all, but I particularly feel female pediatricians are more humane, more more how to handle children more better than males, I think. And children also had to get a motherly figure, so they also get to they also get very friendly with you.
या अगर मैंने अपने हस्बैंड को ना देखा होता तो मैं तुम्हारी बात मान लेती बट आई थिंक ही इज इट्स सो मच कंपैशनेट एंड सो मच पैशनेट दैट आई हैव नो
Yeah.
वर्ड्स एंड लाइक माय चिल्ड्रन आर इवन मोर क्लोजर टू हिम so in my perspective, Sony, I think it does not depend upon whether you are a male or a female. It depends upon what kind of attitude, what kind of nature you have, and how much compassionate you are towards the children. And that can be a male, that can be a female. Every father loves his children. He is a male. So
Yeah.
if you are considering them as your children, obviously you will be a better pediatrician. So you have to relate yourself to the children. I know Meenakshi is a very good pediatrician, but I seriously have reservations that only females can have a better pediatricians. Okay. So, what are the different career perspectives, Meenakshi, that we can have after the PG residency in pediatrics? Like, what are the super specialities or the fellowships options that we can go for?
So see, there is a fellowships. Of course, there are many fellowships. Right now in Vadia, where I'm working, there's a fellowship in everything you say. Just name this from gastro, hepatology,
Mm-hmm.
IPCU, NICU, hemat-oncology, so endocrinology, neurology, nephrology. There's a fellowship in everything. And then there are FNBs also. So where you give the NEET super specialty exam, it's a 2 year, like it's like a DNB. So it's like a 2 year course. Then there's FNB also, and then there's DM, super specialization. So DM is also again in a neonatology. It's very famous, hemat-oncology and endocrinology. So there are different DMs. So for DM you have to give the SSK exam, NEET SS, and for FNB also you have to give the NEET SS. For fellowships, most places have direct interviews actually. Then there are various other fellowships like MUHS fellowship in Maharashtra, at least IAP fellowship all over India, then NNF fellowship for neonatology, then IAP other various chapters. So IAP is Indian Academy of Pediatrics. They have various fellowship programs. So it depends on your interest.
So, how many seats are there? Like, is it really tough to enter there? And what kind of preparation, like, were you preparing along with your post graduation for something, or are you preparing nowadays for
Hmm.
something? Is how much possibility it is to study along with your residency?
So with your residency is not possible only, I feel. And however, I think SS exam is more like what you have read over 3 years, and you just need to re-revise Nelson. What senior says, just read Nelson 3 times word to word. You should know Nelson, and you know how big textbook Nelson is.
I think, I mean, this is a not a small task. Read Nelson word by word.
Yeah.
Oh my God.
Yeah, so they said read Nelson 3 times word by word, and then you can crack SS exam. So, anyways, it's so there are fellowships are many. You won't have really difficulty in getting into fellowship in any subject. So it's not very difficult. Basically, you get it by interview, and almost places say that work with us for 3 months as SR, and then we'll take you as a fellow. And
So they are
fellowship
not
is
taking
not
any
an issue,
separate
but of course,
separate examination. They are not taking any
no,
separate
no, no. Fellowship is
examination.
only by interview actually. Depends on number of applications have come, and then they just take interview, and then they're like criteria like okay, then who's the highest marks in the final year, then final
Mm-hmm.
MBBS highest marks. So it's very
Mm-hmm.
simple, and so that's nice. After DCH, you need to work. You have to do secondary DNB and all. Then you have to give an exam again. But otherwise, fellowship you don't have to give any exam. For FNB and SS, you have to.
Okay. Is super speciality really necessary in pediatrics? Like in MD medicine, they are asking, like after medicine, most of the people are doing. So is it necessary after pediatrics also?
No, I don't think so. And I also don't plan to do any fellowships or any SS because general pediatrics is a very vast field. So I particularly feel in pediatric, when you do super specialty, you become very narrow down. Then you once you do nephro, then you'll be seeing only nephro patients and all. But general pediatrics has a lot of scope, growth,
Mm-hmm.
development, immunization, nutrition, and
Mm-hmm.
common illnesses. So I don't think even if you have to set up your own private practice, I don't think it's necessary to do some super specialization. And I think general pediatrics still have that scope rather than general medicine as compared to medicine. It still has the scope. It's a vast
All
branch.
right.
Knowing when to refer the patient is also an art. Knowing that the patient will require knowing when the patient will require hemat, that's also an art.
Yes.
So, of course, you can manage nephrotic syndrome, thalassemia. These are hemat nephro, but these are not to be managed by the hemat and nephro people. You can manage it. Resistant nephrotic syndrome, not responding, thalassemia, atypical cases, having scope of BMT. Yeah, you can refer. But you don't need to refer every plain patient.
All right. So there's one question: ki post PG, which is better, pediatrics or OBG? Himaja, I think it depends upon the person. If you have interest in OBG, then post PG also you will like OBG. If you have interest in pediatrics and post PG, you will like pediatrics. It is no universal fact that this is better or this is better. It depends upon you that which one you are liking more, right?
Exactly.
Okay. So, um, amazing journey, Meenakshi. And we are very happy and proud that you have, been with us from such a long time, and we were a part of your success story from the second year itself, and then PG, and even now you have joined the SRship. And I think we have answered all the questions, and people must be happy because previously abhi in days mein, when I was talking with the rankers, they have a lot of apprehensions about the different branches, and that is why we have started this initiative talking to you. So I think now all the glitches and all the dilemmas are about the PG residency in pediatrics must be clear to you. And thank you so much for sparing your time. And we wish you all the very best for your future endeavors too. If you want to join any super specialty, may you have the best of it.
Thank you so much. And DBMC have always been in the front foot in helping students and guiding students. So I think that's a very great initiative of you, and thank you for making me a part of it.
Thank you. God bless.